So in phase 1, we were just learning about the virus. We shut everything down, tried to get control, tried to bring the curve down to flat. In phase 2, we had accomplished pretty much what we wanted to do in terms of bringing it down and flattening the curve. Now, in phase 2, we needed to see how much we could open things up again before we started seeing major amounts of disease transmission. Well, it worked and it didn't work. In phase 2, we saw people were tired of COVID-19. People were tired of each other and being at home and watching a whole bunch of Netflix. So they really wanted to get out and do things and have fun. Unfortunately, that meant they ran into other people that wanted to get out and have fun who carried the virus. So we've seen the numbers, and we expected the numbers to come up slightly in phase 2. So we started moving into phase 3 of the response and trying to open things up a little bit more. That hasn't gone so well. We've had a significant number of new cases over the last period of time, but things have changed. The number of cases we're seeing now are primarily in the 20 to 39-year-old age group. So it's young people that want to get out and hang out at a party and do the stuff that young people are supposed to do. Unfortunately, in the circumstance that we have to recommend, what is it Dr. Bonnie says? Fewer faces, bigger spaces. Up until the end of June, we only had 86 cases in the province among First Nations people on reserve and off. We had 5 deaths, tragically. But we've done really, really well considering we're talking about a population of about 160,000 people. So communities had responded very effectively to the recommendations that were put forward about stay home, don't go hang out in large groups, definitely stay home if you're sick, and take good care of yourself. You may be tired of it, but COVID isn't. So the goal is to stay home and make that happen. And First Nations did that very well, from a family environment all the way to a community environment where they locked down the community and really restricted the number of people that were coming and going. But again, that young group of people going out and hanging out with friends seem to have not quite gotten the message. So we know that we're in this for the long haul. So continuing to keep your bubble small, have less than 10 people that you see on a regular basis, and you're among the only 10 people they see on a regular basis. One of the challenges we have is that Charlie over here has these 10 people in his bubble, but one of his friends has another bubble of 10 people, and one of his friends has another bubble of 10 people. So Charlie actually is in a bubble with 30 people, many of whom he doesn't even know. So we really recommend to people that they continue to stay home as much as possible, keep the bubble small, less faces, bigger spaces, wear a mask when in public. When you can't keep a distance of more than 2 meters from the people around you. Really be cautious about hanging out with people you don't know. Don't go to work when you're sick, if you go to work at all. Or don't go to school when you're sick, which is something that's coming up. And take care of each other. The be kind, be calm, and be safe that Dr. Bonnie says regularly is a big piece of what we need to do.